Everybody talks about onesies and diapers and very expensive strollers, but there are 3 medications that every family should have on hand for their new baby. I think this is important to have in your nursery just in case you end up needing them. They're so nice to have on hand.
Attention, attention. Paging the pregnancy nurse. She is a nurse, but not your nurse. Thank you.
And little known fact about the pregnancy nurse, I actually started my nursing career working phone triage in a very busy pediatric office. I talked to lots of very stressed out moms of newborns or new babies who, when they had these medications on hand, felt so much relief that they had something that they could give their baby. These are not expensive, but they are so handy. Let's talk about them. The first one is Tylenol. Now there is infants Tylenol and there's children's Tylenol, and I've heard that the dosage is the same. You can check on the bottle. It probably depends on the different brands of Tylenol. Tylenol is also known as acetaminophen, but I think it's really important to have on hand. Now, if your baby has a fever or has anything that you're concerned about in those first 3 months or so, you're definitely going to want to call your pediatrician. You shouldn't just be giving them Tylenol. But after that point in time, having some Tylenol on hand can be really handy. And you may even need Tylenol ahead of it, and just having it on hand rather than having to stop by the pharmacy can be really nice. And this is actually a whole post on my website that I'm going to link down below in case you guys are wanting a little bit more information about what to watch for with these different medications, etc. The next one is some liquid Benadryl. Now, you are not likely to need to use this in the first year, but it is so nice to have on hand in case your baby has an allergic reaction to something. You can give them Benadryl at home. You don't have to run to the drugstore. Liquid Benadryl is cheap. I think you can even find it at the dollar store. In fact, you can find children's Tylenol at the dollar store as well. But it can be really helpful if you end up needing it. I recommend that every family have some on hand. Of course, if your baby is having an allergic reaction, you might want to call poison control or your pediatrician. Again, I'm not telling you when to give these drugs. I'm just saying they're nice to have on hand so that when you talk with a provider who says you should give them some Tylenol or some Benadryl, you already have it on hand. So handy. Editor Hillary here to tell you that you actually need a way to give them the medications as well. So there's something like this. It's a little dropper. It has like all the measurements on there that you'll need to give them the right dosage. You can buy these on the baby aisle. They're super cheap, super easy, great thing to have on hand. So you just draw it up. I actually keep this on hand because it waters my plants now, but very handy. I would have one of these as well. Now the last one, not really a medication, but it is diaper cream. Some newborns, in fact, get really red bottoms just from wipes or whatever. I actually made homemade wipes with my kids for the first couple of weeks, just using paper towels and a little bit of baby wash because their bums would get so red. So having some diaper cream, personally, I think there's 2 different kinds. There's the Desitin type that is white that makes a covering and coats your bottom. And then there's the like more Vaseline type, A&D ointment, Aquaphor, the more clear goopy type. That's more for the healing. So I like to put a little bit of Aquaphor on the bottom and then cover it with Desitin. Any questions about diaper rash, definitely talk with your pediatrician so that they can give you some tips. I've seen a lot of good tips on social media about diaper rash, but I'm not going to give them here because I'm not an expert at it. But I just know that if you have a red bottom, it's so nice to have that on hand. And I do recommend kind of the 2 varieties. And again, if you're like, Hillary, I don't have a clue what you're talking about, I have all of that linked in the post about this. Now, if you're like, what other medications should I have on hand? Honestly, I don't know, but there are some that you definitely don't need to have around in those first even couple of years. One is cough and cold medications. There are no cough or cold medications that are recommended to give to small children, so no reason to have those on hand. Stomach medication like Pepto-Bismol, again, you don't give that to babies, so you don't need to have any of that on hand, at least not for baby. And actually, there's all these teething medications. They don't really recommend a lot of those as well. Some of them numb the gums, some are homeopathic. Again, talk with your pediatrician, but I wouldn't load up on teething remedies until you talk with your provider about what they recommend beyond Tylenol. And once your baby gets past 6 months, smart to have some ibuprofen on hand as well. And if this just got you thinking, Hillary, what other medication should every family have on hand? I definitely recommend aspirin, not for baby at all, but if you were to be having a heart attack, which can happen to people of any age, on the phone, they will recommend that you chew some aspirin. So it's smart to have some aspirin on hand for every family. Of course, all of this should be out of reach of children. And again, I recommend every family have Tylenol, ibuprofen, and Benadryl on hand. I think those can be really helpful, especially in emergency type situations with the Benadryl, etc. Now, don't just get your medicine cabinet prepared for baby. Make sure that you're preparing your mind as well. I actually have a birth class that I recommend. I'm going to link it down below. Now, this is just about medications, but I actually have a no-fluff baby's necessities checklist that I'm going to link to up above and down below because I think that's going to be really helpful. There is so much marketed for babies out there anymore. I want you guys to be able to laser focus about what's really important. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your hospital birth and bringing baby home.